Today's conversation is with Dr. Phil or Dr. Philip Pierorazio. I'm butchering his last name, as you will, as we discussed in our conversation. Dr. Phil, we call him. He's the Chief of Urology at Penn University of Pennsylvania, Department of Urology in Philadelphia. Beyond his clinical work, Dr. Phil has contributed extensively in research in urologic oncology. Interestingly, though, he's renowned lecturer on wellness, physician wellness, and creator of his podcast, Operate with Zen, in which he discusses a scientific and data-driven approach to mindfulness in medicine and surgery. During this conversation with Phil was amazing. We discussed mostly on mindfulness and meditation. He's a surgeon trained at Hopkins, obviously, top-notch institution. And we talked about our when we met back at Columbia in the early 2000s, where everything I did in holistic urology was poo-pooed, and now here we are. And now even Phil is practicing, meditation and things of the sort, where he thinks has even improved his surgical outcomes. We talked about his meditative approach as a practitioner and a physician, and what's his approach with patients, how he handles patients when the going gets tough in a clinic, how he gets himself in a Zen state before going to the next patient. Wonderful conversation with Phil, Dr. Phil from the University of Pennsylvania, urologic oncologist and an expert in prostate cancer. Let's go. Welcome to the Dr. Geo podcast. I am your host, Dr. Geo, where it is my intention to help you with your prostate health and how to live better with age. Today we have Dr. Phil. Phil, I'm not even going to try. Let's just call you Dr. Phil, just Perfect. Because I was practicing before we got on, and then I forgot the pronouncement, right pronouncement of your name. I'm not going to do it. So other than Dr. Phil, how do you pronounce your last name?
Yeah, it's Phil Pierorazio, but Dr. Phil is fine.
You do look like Dr. Phil a little bit. Too bad that name. I'm happy to know that Dr. Geo has never been taken by any celebrity, anything, talk show host or anything. So, but Dr. Phil, I don't know.
I used to have more hair than he did.
Actually, I remember when you had more hair than he did.
That's right.
Back at the Columbia days where we met, mid 2000s, right?
Yeah, almost 20 years ago now, Gio. Can you believe that?
We're not that old, man. I was hoping you didn't say that. Phil, what got you? You have a tremendous resume, including being a catcher, Division I catcher for the Georgetown. Let's start there. I mean, and the reason, so my son is a catcher. So here you are. I look at, once I'm done with work stuff, which is almost never, of course, I'm looking at Instagram videos on catching and the right approach and blah, blah, blah. So I'm trying not to live my life vicariously through my son, but he is a catcher at the age of 10 or 11, and he's been doing so for a while. So it's a very fascinating position for me, and everything that's involved, and you're like the quarterback of a baseball team. So how long? I mean, it's impressive. How many urologists, let's start there, do you know that's played Division I sports?
Yeah, so that's a funny question, Gio. So there's actually 3 of us who are contemporaries who were college catchers. Yeah, and I'm sure there's more out there, but Trinity Bivalacqua, who's a urologic oncologist, actually with me here at Penn, and we were at Hopkins together for a long time, was a catcher at Tulane. And wow. Brian Shook was a catcher, and he's a kidney cancer expert out at UCLA. All catchers in college.
Wow. Just like there are many catchers who are managers of a team. So I don't know. There is certainly a leadership thing that's associated with that. So how was you started playing catcher at what age?
To be honest with you, I dabbled in it my entire life. And then in high school, I played with a guy who got drafted and was unbelievable. So I didn't get to catch that much in high school, but I came to college with it on my resume. And that's where I fit in best on the college team, was catching there. So
yeah, there's not that many. So or at least there weren't. certainly when you played. So probably it's like, oh, you're a catch, great,
Yeah.
you fit right in,
Yeah.
right? Even now, there's just there. Leo goes to a catcher's camp, and it's such a culture. It's not a baseball culture; it's a catcher's culture, right?
There's
So it's like, catchers, I need you to do my catchers, and it's almost like they're all wearing the gear all 4 hours. Is hot, and you kind of constantly doing drills. I just love that position.
Yeah, and it's interesting kind of how that worked out too, Gio, is that, I think that skill set really refined itself in college, where it was a little more cerebral, and it was more, yes, for the physical attributes, but more of the leadership qualities and some of the other capabilities that I could take on. And honestly, I couldn't hit the guys once they started throwing mid upper 90s, but I could catch them, and I could, I could work a pitcher, and I could work the team, and those leadership abilities, I think, came through in that position.
Yeah, I do see it for my son more so than him, making it to the major leagues or whatever. That's definitely not the intention. I think I look at it as a developmental and the leadership skills that he may learn from that, which is pretty apparent to me even at his age. But certainly you see it, Division I baseball, which is now happening, and the play championship games are happening, and in college, and of course in major league. Yeah, that was fascinating. I remember that's one of our first conversations back in the Columbia days. I was like, wow. Speaking of the Columbia days, so when I was there, there was a element of me kind of trying to stay in the closet, but as a holistic doctor, because certainly leadership, with the exception of Aaron Katz, really didn't care about the holistic element of what I had to offer. I didn't think. And it was just, it was before its time, I would say. Research was becoming a little bit more apparent at that time. It was coming out little by little. Certainly now we have a lot more research. Lo and behold, 20 years later, every time I go to the AUA, which is the urological conference, national conference, there's more and more people interested. And what is it that you do? And how would you handle prostatitis? Of course, that's the first thing, right? Very difficult urological condition, and in prostate cancer. So now I get invited to all these, Jay Shaw, right? I said, Geo, I need you to give a grand round at Stanford University Department of Urology, right? So Jay Shaw trained back in the day with you at Columbia. He was a resident, I want to say, back in those days. And 20 years later, I'm in shock that these things are happening. Then I see you recently in Chicago, and we talk, and I have no idea. I haven't seen you in 20 years. Yeah, you did have more hair. That's the first thing that came. I can't remember. I don't even know how I remembered you so much. But I started connecting dots. And we were talking about, operating in Zen, and that's your podcast, and mindfulness. And I'm like, wow, am I in a twilight zone here? Like, Phil is a surgeon trained in, Columbia University, then went to Hopkins, the cream of the cream. And we were talking about Zen, operating in Zen and mindfulness. What's up with that? Like, how did that happen?
It's a good story, G. I'll try to give the short version, and then we can take it in any direction you want. But like most people, when COVID hit, I found myself with a lot of downtime and wanted to find a way to better myself as a surgeon and as a human being. And honestly, one of the simplest things I've ever said is, you know what, I got to get more flexible. Let me just pick up some yoga. And so I started doing yoga. And yoga turned into mindfulness and meditation. And I started reading about all of these things. And mindfulness really resonated with me, the basic principles of mindfulness. And it reinforced a lot of the good behaviors I was actually doing for a long, long time, dating all the way back to the catching days, about kind of being in the moment.
Yeah.
It also gave me an explanation for some of my failures and some of the poor behaviors I had. And the way I like to put this now is it serves as a great platform for going forward in a direction I want to live my life in, as a surgeon and as a human, as a father, as a husband, and all of those things.
And so what did you do? What was Did you like practice? I mean, we did have a lot of time. You were probably not operating a whole lot during the early days of COVID anyway.
Yeah.
Um, I know a lot of people took on a plant-based diet because they started watching, Netflix, right? So, you know, um, all sorts of documentaries on a plant-based diet and so forth. So many people changed their lifestyle to the better, though more people started drinking a lot and so forth. It's a very interesting phenomenon. What did you do? Did you start doing transcendental meditation, or what did you do?
Yeah. So I started meditating every day.
For how long?
And yeah, so daily meditation doesn't need to be that long. So
Mm,
right now, my current practice is 10 minutes a day in the
mm,
morning after I
mm,
work out. And if I get lucky, I'll do something again at night. Sometimes I do it to help me wind down and go to sleep.
mm,
So this
mm,
doesn't need to be major commitments.
mm,
I don't do transcendental meditation, which is basically mantra based
mhm,
meditation for people
mhm.
who aren't familiar. The meditation purists will actually not like what I'm about to say, but
It's okay.
I like doing lots of different kinds of meditation.
Yeah.
And there are different styles and different ways to meditate. And I'll
Yeah.
explain a couple in a sec. But the way I think about it is if you go to the gym and if you just did bicep curls, all you're going to do is get big biceps. But we
Yeah.
want to be kind of a well rounded, whole, strong person. And so if
Sure.
we're going to work our mind in meditation, there are benefits to different types of meditation, in my opinion. So I will alternate between, just kind of mindfulness meditation, which is sitting and focus on breathing, or spatial stuff. I will sit outside, just take in nature and things around me. I will do loving kindness meditation. I will do gratitude meditations.
Mm,
I will do body scans often. So there's lots of ways, and each I think works on different things, but each hits those key components of mindfulness, basically being present and being in the moment.
mm. What's your breathing pattern like when you meditate?
Yeah. So I always start the same way. I do 3 deep breaths in the nose, out the mouth, typically an ujjayi breath, kind of with
Hmm.
the tongue compressed on the top.
Very
I think
nice.
it
Yeah.
just kind of helps set the tone.
Mm,
And then I allow breathing most of the time to return to normal breathing. Sometimes I will do breathing exercises. I like box breathing, when you can kind of breathe, hold, exhale, hold, usually for counts of 4. Sometimes I like doing, especially with my kids, when we're trying to
mm,
wind down at
mm,
night,
mm.
doing kind of extended intervals. So breathe in for 4, hold for 5, breathe out, then hold for 6, then hold for 7, and kind of see if you can extend that
Love it.
hold.
Yeah.
And that's what I do with my children a lot. I think that's a really nice way to wind down and kind of quiet down the system when it's, a little overexcited. But, everybody's going to have different things that they respond to and they like. That's currently what I'm doing.
I have a recording that's not yet published with Sachin Patel. He's a physician out in Toronto on breathing. All we talked about was breathing and different approaches. I mean, it's fascinating. Um, and he talks a lot about the benefits of holding longer periods of time. Of course, very scientific, like what is happening to your body, how you calming down the vagus nerve. Also, when you want to calm down, you want to exhale for a longer period of time than you inhale, right? The opposite is true too. If you want to increase your energy for focus or whatever, you want to breathe fast, right? That's stimulating the central nervous system and the fight or flight response and so forth. So if you're too stressed, do the opposite to calm down, particularly at night to sleep. But if you need more energy, you need to amp up a little bit, then you breathe faster. It was fascinating. So I'll let you know when that comes out. Well, you know, so I am a 10-minute meditator. Um, I always say, I'm a New Yorker, so give me the minimal effective dose for everything, please. Like, I don't think I'm going to do an hour. I'm not going to the Himalayas anytime soon. What's the minimal effective dose? Right.
Yeah, I'm with you too. And I think that's some of my New York roots too, man. I'm a New Yorker too. And I don't know if you're going there, Gio, but I mean, the data actually says 7 to 8 minutes
Yeah.
and you will see benefit.
Yeah. That's right. I had a situation where I meditated for an hour, right? First time. So I always did my 10 minutes, but then I did an hour, right? I was in this facility, whatever. I was actually hosting a prostate cancer retreat, and I had a few meditative experts. And so he had the whole class, and I participated in meditating for an hour. That was something else. It was something else. So I thought when I did my 10 minutes, and I still do primarily 10 minutes, that was it. And then when I did it for an hour, and again, I don't do it because it's just not practical. And I think that's why the studies won't study meditators for an hour, right? Because like who are we going to study? It took about 20 minutes to really calm down my brain. And then for the rest of the time, it was like an out of body experience where I felt like my let's just say my spirit, not to be overly pokey here, was outside of my body looking in at me. And that, like, I really was in the moment, and just kind of almost like what I haven't done psychedelics, but when I hear that people do psychedelics and all sorts of things happen, um, that's what it felt like when people describe that. And my understanding is that meditating for that long can have a psychedelic type of effect. Um, so that's that. Interestingly, as you said, I like to do active meditation. I don't know if you do. So when I'm working out, I try to meditate when I'm taking the train to the office, right? Or be mindful. I think some of these terms are used interchangeably with my breathing and so forth. What do you do? Let's say, do you have any practice while you're at work? Sometimes when I'm at work between patients, because maybe the previous patient was a lot in terms of their diagnosis, and it just, very emotional. So I need 5 minutes to like meditate and before the next patient. Do you have any practice while you're at working and seeing patients?
Yeah. So first, I would say surgery is one of the most mindful experiences you can encounter. And when this doesn't happen in every operation, but when an operating room is at its best, everybody in that room is focused on one thing, one patient, one problem, one solution. Nothing else is going on in the world. That is the definition of being mindful, right? It's being present. It's being aware of what's going on in the moment, and it's being non-judgmental. Those are the three kind of key components. And a good operating room is like that. So I tell surgeons all the time who are natural skeptics, you're being mindful all of the time, and you love being mindful. You just don't know it. And you bring up a really good point that you don't necessarily need to meditate to be mindful. Operating room is one of those times. I haven't done it in a while, but I agree with you. Sometimes clinic can just get taxing and really stressful. And that's when I go to that literature I referenced before. 7 to 8 minutes actually of a loving kindness meditation can change your outlook on a day. Now, loving kindness meditation is basically, it's a nice way of saying you just wish well wishes on other people. You start with yourself and you just kind of expand your circles, and it helps you give gratitude and deal with stressful situations and kind of change your outlook on them. So I've done that. I haven't had to do it in a while because clinic's been okay. But that is a practice that I can do it. So I'd say the 2 times at work, definitely the operating room, and I think stressful situations, a loving kindness meditation, even if it's a few minutes, will help you.
You seem to have an office. Many practices, including at NYU, we don't have offices anymore, right? So they're doing without, just to save those rooms for examination rooms and so forth, right? So I miss my office when we did have one, because that's part of what I used to do. But I still find places and find your little corner and so forth. And sometimes, put on headphones. I'll be left alone looking at a certain place, and I just do it, and you're just left alone. So there's always ways to do that. How has meditating and being in a Zen state, I'm just using that term because of your the title of your podcast, Operate with Zen, or in Zen. How has that helped you as a surgeon? It's already a mindfulness state, even for those that don't meditate. So have you found that you're more in a relaxed state, better care of your, so one of the major problems that I find, I'm not a surgeon, of course, that I find with surgeons is that it's taxing, right? So they burn out, and burnout factor is a big deal amongst physicians, right? Do you find that you are able better to conserve your own health from practicing meditation and being in a Zen state?
Yeah, I do. And, just to clarify, and I think you're saying this, Joe, I mean, listen, I'm not a Zen Buddhist. I don't practice Zen Buddhism, but I think that, Zen is a great metaphor for people to understand about being kind of in this
Yeah.
mindfulness kind of state or thought process.
Yeah.
And it has helped me tremendously. And once again, those key concepts of mindfulness can be applied to so many aspects of our life. Once again, right, being present, being aware, and being non-judgmental.
Mm-hmm.
And you can think about it, everything from self-identity, right? So many of us, and I think about my early career, I didn't know who I was as a physician and as a surgeon. And I had all these ideas of who I wanted to be or who I thought I should be or who my boss thought I should be. But really taking the time to be introspective and thoughtful about, okay, this is who I want to be. This is what I'm good at. This is what I enjoy doing and what I get meaningful or fulfillment out of. That is one of the things I think that a mindfulness practice has really helped me reflect on.
Lovely.
I think it really helps with time management, because once you know kind of who you are and what the important moments of the day are, it makes decision making much easier. You're not worried about, should I add on this patient or go to that meeting? No, if my priority is my children and seeing my girls before they go to bed, the decision making is effortless. So now I have more mental energy and time to spend on things that are meaningful, like actually like my kids and like podcasts like this, and spreading the word about how to be a better person, how to be a better surgeon, how to be a better human being.
Man, I love that. I love that. I love what you just said. I think that burnout comes from a result of you not being aligned with what you really value. So what you do is not aligned with what you value. And so if you don't spend time alone quietly to figure out what you really value and who you really are in your every fiber of your body, then the job, the business, the work will take over and just dominate your life. And you are still working harder, hopefully making more money, though the two don't go hand in hand all the time, but not happy, right? And it's we would agree that is an empty existence if that happens.
And the technical term, Geo, is called cognitive dissonance.
Yeah.
And I like the terms being and doing. When you're being and you're doing are off, it creates cognitive dissonance, and it creates a lot of internal emotional strife. And that's something we have complete control over. We can't control how many patients the hospital wants us to see or how we structure our life. No matter what job you're in, there's certain things you cannot control, but you can control your being and how it aligns with your doing. And that can create a lot of happiness and a lot of decreased emotional issues if you just understand those things.
I'm listening to you and it's like, man, if I have prostate cancer, I want to go to Phil. Like, I just want to go to Phil. And there is, so Jim McKiernan, who so he's the director, the chair of urology at Columbia. And I mention his name because he's one of the most fascinating urologists I've ever worked with in terms of his ability to connect with patients and his care for patients. And of course, one would say, well, you're a doctor, you're a physician. Of course you care for patients. I would agree with that. But the caring is different and how you manifest that is different, right? He listened, which oftentimes caused him to be backed up in his office, of course, and, 30 minutes for, so. But I remember him saying one day, look, if I can't do things this way, and if I can't listen to the patient, then I don't know, I'll go bartend somewhere. And, it was fascinating to hear that coming out of his mouth. Which leads me to what I'm trying to say is that, and he's obviously a tremendous surgeon. Like, I would send a family member to him. So these things can go hand in hand. Many of the complaints that I hear from patients is, yeah, he has a great reputation, but my God, no bedside manner or things like that. I cannot see you not having good bedside manner, although I've never been your patient. So what's your process like with patients in the office? Like, what is it? Do you have rules? Do you have, in 10, 15 minutes, I have to move on. What are your rules, personal rules with patients?
Yeah, great question, Gio. And I would say, Jim McKiernan is an outstanding human being, an outstanding surgeon, an outstanding role model. He's one of the reasons I'm a urologist today and I am where I am is Jim. And he set great example for many of us. I think the fun part is I actually don't have any rules. The couple of rules I have is I don't spend a lot of downtime. So I go from one patient right to the next patient. I kind of have prepared and I go in, and I will take whatever time it takes with that patient to feel satisfied with that encounter. And sometimes you run into trouble. And today I ran a little bit late. I don't usually run late, to be honest with you. We're able to get most of what we need to get done in typically 15 to 20 minutes per patient. But sometimes it takes longer than that. And if I'm running late, the first thing I say to the next patient is, I'm really sorry I'm late. I really appreciate your patience. And I'm going to take however long it takes to solve, to fix your problems today too.
That takes care of it.
And we're going to listen.
Sure.
Right?
That takes care of it.
And this is another great example of where mindfulness actually reinforced a lot of what I was doing. And so the key is really sitting down with that patient, being in that moment. Don't worry about the next patient. Don't worry about the patient before. Don't worry about what you're doing tomorrow. Just in that moment, enjoy that moment. And you've done this. We've had, say I'm meeting with a prostate cancer patient. I've had this conversation thousands of times at this point. But that's that patient's first prostate cancer conversation, or maybe their second or third, 100%. If it's another opinion, right?
100%.
And understand where they're coming from. And, the basic, just kind of give them the basic information, understand where they need the conversation to go. And the hardest part is no judgment. That's the beauty of who we are as physicians sometimes, is that we don't pass judgment. It doesn't matter who you are, what your background is, what you're thinking. We help you through whatever process you're going through, and we don't pass judgment. And I think that's one of the beautiful things about our profession that we have from other fields, to be honest with you. So those are the rules I have: is don't pass judgment, take time, meet people where they are, and hopefully try and sum up and resolve a situation before people leave.
Yeah, that's beautiful. Because sometimes patients do feel like they're rushed and so forth. And I think people should practice some meditation, honestly, for their own well-being as physicians, but certainly for the benefit of the patient. Have you found that your meditative practices improve your surgical outcomes, even if it's just subjective?
That's a great question, Geo. I haven't looked at it, and I'll joke and just say my outcomes are so good, I can't imagine how they get better. But we know that's not true.
0% incontinence. Everybody has erections after surgery, right? Is that what it is?
Yeah. No, but I'll tell you what I think it does do. I think in the challenging cases where you're really struggling for whatever reason, and it could be anatomy, it could be your psychological, emotional space, it could be that you're struggling with other things, the practices of being able to refocus, recenter, and understand that you're struggling, and be able to say, you know what, all of that other stuff is stressing me out. Let's put it out of my mind and focus on, right now we're at the nerve bundles. Let's focus on nerve sparing. We'll deal with that stuff later, right? Or, we've got to do a really good anastomosis here and make sure that this guy's got the best chance of a good functional outcome. Let's really focus and forget about everything else that's going on. Because some people, and I would say myself, even before more formally doing this, sometimes you just don't realize that the wheels are spinning. Right? You're just kind of going, and you don't realize that you're getting pulled in 12 different directions. And what meditation helps you do is recognize, okay, I'm feeling this way right now, whether it's a physical, emotional, or psychological state. All right, I'm feeling stressed right now. I'm feeling emotional right now. I'm feeling tired right now. My back hurts right now. And you can't ignore those things or move on unless you actually recognize that that's what you're experiencing. So it helps you be aware of the situation in which you're experiencing, and then readjust your focus as needed.
Oh, lovely. Do you think there'll be a time of day where, like, we will host a meditative practice at the AUA, where we teach them a couple of tools? You think the day will come?
So we do it unofficially now, right? So there's some of us who meet and we'll do yoga and kind of meditative stuff as kind of a group of friends who are similar minded and interested in wellness. You will notice last year there were more courses about professional development and wellness. I think you'll see even more next year about potentially meditative practices and mindfulness and being a surgeon. And I'll say there's some really smart surgeons around the country who are working on something called ESRT, or evidence in stress reduction I'm saying it wrong.
Radiation therapy?
No.
The R
Yeah. No, it's
RT. Every time you hear RT, yeah.
Yeah, it's basically a spin-off of meditative practices for surgeons. And the concept is to teach the things I just talked about: how to be aware of what's going on with yourself, how to focus in the moment, how to reappraise emotions and redirect them.
Mm-hmm.
And they're doing it at UCSF. Carter Labaris is a general surgeon there who does this regularly and teaches all of the interns this. And I think you're going to see more of this in surgery. We're working on it in Penn. I am not that I'm not interested in the residents. I'm more interested in the junior faculty and helping us build this in our junior faculty. So that's where we're focusing this. So that was a long answer, but yes, I think we're going to see more of this in surgery. I hope we see more of this in surgery.
Oh, lovely, lovely. Prostate cancer. So roughly how many operations have you performed, and what's your approach? And I really wanted to hone in on your Zen approach and your meditative and mindfulness approach, but let's talk a little bit about outcomes and just prostate cancer.
Yeah.
How many have you done, and what's your approach with regards to who you would recommend a surgical procedure? I just don't think it's black and white, or it might be, but not for everyone. Some people, Gleason 6, let's do it right away, and they convince the patient to do it. Other people, Gleason 7, 3+4, you know what? Maybe you could be on active surveillance. So what's your approach?
Yeah, it's a great question, Geo, and I think it's a moving target as we understand more about the disease, and it's amazing where we've come in 15 years that I've formally been a urologist. When I first started, all we operated on was Gleason 6, and if there was a complication or an issue with a Gleason 8, 9, or 10, man, you were in big trouble because that person never should have had surgery. And then we realized, listen, Gleason 6s don't need surgery, and I think it is very hard pressed for me to actually offer surgery now to somebody with Gleason 6 disease. And when we talk about it, the people we do talk about in surgery, I tell them, we're not operating on your Gleason 6 prostate cancer. We're operating on your risk of developing a more aggressive cancer down the road. So that's typically somebody with an incredibly strong family history or BRCA mutation or something else, a really young age with one of those things that just says this is not the right person, or active surveillance is not going to be a durable strategy for them. So, I think the wheelhouse, the ideal patients, Gleason 7 patients in general, are patients who have curable prostate cancer with a single modality, and their choice, whether it's surgery or radiation, for the vast majority of them. I think we all know younger patients tend to recover better from surgery and are subject to the long-term toxicities from radiation. So men in their 40s, 50s, early 60s with long life expectancies, we tend to favor surgery. In, I think, older patients, we have to be honest with ourselves. And, I know my outcomes. I know a lot of surgeons do. Listen, my continence outcomes in men in their 70s isn't as good as men in their 60s, isn't as good as men in their 50s. And
is that a function of the fact, is it age, or just the fact that men as they age are in, less better health than younger men?
Yeah. The analogy I always give Gio is, listen, if you were 18 years old and you rolled your ankle, a week later you're running around, playing, and it's like nothing ever happened, right? But at 50, 60, 70 years old, you roll your ankle. It takes you longer to recover, and your ankle may never fully recover till it to the level it did when you were 18 years old.
Sure.
And surgery is a physical insult. And the way I think about it is, some men are just never going to recover their urinary control, and that number goes slightly higher as we get older. And the length of recovery is just more challenging for men as they get older. So it's not that men in their 70s can't have surgery or shouldn't have surgery, or we don't offer it. They just need to understand their recovery is going to be different.
Are you doing any focal therapies currently?
I am not personally, but we are here at University of Pennsylvania. And I think for the appropriately selected Gleason 7 prostate cancer, that's the sweet spot right now. And once again, these are all moving targets. As we learn more, as we investigate these things intelligently, we are certainly expanding indications and thoughts about them.
Lovely. With my patients who are waiting to be operated on for prostate cancer, I have a peri-surgical integrative protocol. So I think so I'll tell you what protocol is, and then it leads into my next question. So the protocol is deep diaphragmatic breathing. So it's a study out of MD Anderson, that showed that deep diaphragmatic breathing numerous days before the surgery and the day of the surgery promoted faster healing and better immune function that was measured with patients compared to control group. So we do deep diaphragmatic breathing. We do pelvic exercises. I call it Kegels on steroids, right? To make sure that the external urethral sphincter is nice and strong. And I do recommend certain nutrients and certain supplements that may help in the healing process that are not blood thinners. Of course, when I have patients around the country, doctors are calling me, Geo, these supplements, why are we doing this? And give them the whole spiel, no blood thinners or very little, etc. So that's my protocol with patients. So it's a trifecta, trying to help them with urinary recovery, just better healing, hopefully from the surgery, and immunity. Make sure that their immune system is nice and strong. Do you have a protocol? To me, it sounds like your patients would be listening to some meditative music prior to, surgery and before they, anesthesia. Do you have a protocol with your patients?
Yeah, I do have a protocol. I don't push, to be honest with you, Gio, I don't push anything on anybody, including mindfulness. I think if people are interested, I love talking about it. It's actually one of my favorite things to talk about, but I don't.
You may have to extend your visits now another 10 minutes after this podcast is published.
Yeah, no, but the things I talk to people about is, first of all, the whole reason we treat cancer is so people can do the things they enjoy doing. So do the things you enjoy doing leading up to surgery. If it's the gym, if it's walking, if it's the movies, if it's gardening, whatever it is, do the things you enjoy doing. Don't give it up just because you're having surgery. Live your life. I do talk about nutrition a little bit. I'd love to hear your take on this. The two things I recommend are, one, get away from high sugary kind of drinks and foods, high fructose corn syrup, those kinds of things. I think for not only for surgical recovery, but I just think lifestyle in general, I think there's really good data to get away from those things. For people who are interested in kind of nutritional or immune boosting, there's data in the cystectomy literature, which is very different from prostatectomies.
Basically, cystectomy is a removal of the bladder for bladder cancer in most cases.
Correct. Thank you. And involves reconstruction of the urinary tract with bowels. It's a very, very complex surgery and a much more complex recovery. But there's data in those patients that basically protein shakes twice a day for about 5 days before surgery can help kind of with caloric intake and recovery. So that's one piece of advice I give people. And then the last, people do always ask about Kegels, and I would love for you to educate me of this if I'm wrong, Geo. And what I always say is, I'm not a huge advocate of Kegels, to be honest with you. So I'd love to hear about your Kegels on steroids. I don't think they hurt. I'm not sure they help before surgery. And the way I think about this is, and the way my mind works, the baseball mind, is that, listen, if you want to be a pitcher and you want to throw faster, you can go to the gym and do bicep curls, and that'll make your arm stronger, but it won't necessarily make you faster. And Kegels prior to surgery can certainly help bulk muscles potentially, but I don't know, and we don't know if those are the ones necessarily controlling continence. I don't think they hurt, right? And I think when the prostate is removed and then we're dealing with a recovering sphincter mechanism, then Kegels and then focusing on kind of pelvic floor musculature helps after surgery. I'm not sure how much of it does before, but hey, tell me what I need to know here.
Yeah, so I would love to tell you that I have published data on this, and I don't. There is published data, and I think it's back and forth, suggesting that before is effective and helpful. And so the reason, so is Kegels on steroids. I don't want to go in. This is about you, not me, Phil. But it essentially is it's Kegels. Then we use a ball and band, ball between your legs. You do a Kegel and you squeeze the ball with your knees. Band, knees are tightly connected to each other. Kegel, then you extend your knees apart from each other. And what I think that does to the sphincter, external urethral sphincter muscle, which should be the muscle that controls urine at that point, because the internal urethral sphincter is damaged from the surgery, is that maybe some of these patients, so I used to do biofeedback on these patients back then. It was just it took too long. And I saw that I'm going to do this anyway on patients. So, but what I did see is that some patients already have a decently strong sphincter muscle prior to. So they may not need it. Others have a weak sphincter muscle. So what is there to lose? I think there's healing qualities in the proactivity of the patient. So rather than just wait till the surgery, do nothing, that process of them being proactive is helpful, I think, in many ways. And B, I think for those patients that do have an external urethral sphincter or the sphincter muscles or pelvic muscles, because remember, these pelvic muscles also help with erections, right? Nothing to lose. It's not like you can hypertrophy it too much or anything like that. So nothing to lose, a lot to gain from that perspective. So, and in general, patients who are weaker physically have a weaker sphincter, and they tend to have a more difficult time getting their urinary continence back in general on average. So nothing to lose, a lot to gain. That's that.
Yeah, I was just gonna say, I think that's awesome. And to use a mindfulness term, it's kind of setting the intention
right
on urinary recovery and helps people be really focused on it. I do appreciate that. And I think that's a great concept.
100%. And I do tell them, when you're doing these exercises, your mind is not at the office or the argument you have with your wife or your kids. You're present. So when you go urinate just regularly, I want you to stop and go, and pay attention to what that feels like. So then when you do a Kegel, you're focused in that particular area. So be mindful, actually, while you do the Kegel exercises. And yes, setting up this intention of, I will hold my urine after surgery. What do I see? And it is anecdotal, so for whatever it's worth, some guys say, look, when they pulled the catheter and they asked me to squeeze, the catheter flew right out. Anecdotal. But and even some nurses said, what are you doing with these guys? Like, wow, like that was pretty impressive. And usually they get their, I hate to give them, you be dry in a week. I don't do that. I kind of tell them, give it 3 months or so, just to put, a lot of times they are dry sooner than later. So that is that approach. And that's the reason why that, but I think there's, there is an opportunity for these, for standardized protocols prior to where, most people can do. And again, the proactivity of the patient in their own well-being, it's like placebo. Well, does that, so this study showed that, the experimental arm with vitamin C, whatever, was as good as the placebo. To me, that doesn't mean that vitamin C doesn't work. To me, that means that, wow, the placebo effect is very powerful, rather than, and I know in science, these are not things that you want to say or do, but I think it's very important to pay attention to and embrace the power of the mind. And I think that's part of it.
Absolutely. And we know this too, men may come in with their significant other and who's very interested in sexual function and recovery. And I said, you know what, listen, one of the strongest predictors of good sexual recovery is a partner who's interested, and it helps hold the intention, right?
No pressure, honey.
Yeah.
No pressure, but you matter.
Yeah, exactly. And
you matter.
It's hugely important that exactly how we focus on these things and where we direct our energy and our bodies and minds resources, hugely important.
Look, I love what you're doing, Phil, and you let me know how I can contribute in any way. I think as a game changer, honestly, I think as a game changer for the patient, most importantly, but equally as important as a game changer for the practitioner, and a method of practitioners' busy practices want to be great surgeons, but it's a method of them of self-preservation also for the practitioner. So thank you for the work you do. And how can people find you? You're going to be linked up everywhere, but how can people best find you?
Yeah, so I'm at the University of Pennsylvania now, Presbyterian Medical Center, which is on the west side of the University of Pennsylvania campus. You can find me on Twitter, Dr. Phil_urology. You can find my email at the Penn website. Our office number is easily accessible, but you can also call 215-662-8699. Happy to see you. Happy to talk to anybody who wants to talk about cancer, wants to talk about mindfulness. I'm super happy to kind of chat about these things. And, Gio, if you wouldn't mind, I'd love to make 2 more comments, if that's
Please
okay
do.
with you.
Yeah.
Yeah. First thing I want to say is, you bring up a really good point. And one of the reasons I continue to do this is you brought it up before. Surgeons are burning out, and you see our colleagues struggling with depression, anxiety, and such. And I think a mindful approach can really help people have sustainable careers. So it is one of the real reasons I can do this, in addition to having more meaningful and rewarding experiences with our patients. And the last thing I want to say is I really want to give you a lot of credit, Gio, because I remember we were both relatively new. We were both new when we first met. And we both were
You had a whole lot more hair than I did, by the way, just to be clear. You had hair, I did not. I was as bald as I am now. Yeah, back in the day.
That is true. But both of us were uncertain about kind of our careers and where we were going. And I'm sure you remember that. And I know, and I remember some of the struggles you went through. And I remember the way.
Painfully so. You say that, and I feel my blood pressure rising. Yeah.
No, but I remember the way people reacted to you and around you.
Yeah.
But I also remember how much you believed in yourself and this mission. And I give you a lot of credit for sticking with it and seeing this through, because it is changing the way people think about prostate cancer and our health in general. And I'm really proud of you. I'm glad I knew you all the way back then. I'm glad I knew you now. We ran into each other in Chicago. It's pretty cool to see all this.
Man, that means a lot to me. It really does, Phil, because you were there, you saw it. And I don't think that a lot of people even recognize the road, how the difficulties of that road. And there was a time there for a minute, I started having kids when I was at Columbia, and I'm saying, what am I doing? I need to, I don't know, do women's health, or I need to get out of here. Like, what am I doing? And it was just because it was many reasons, but I think it was early. And now when many people are embracing it, and I have to tell patients, listen, surgery is good and you need surgery. No, this is really what you need, because it's just, everybody just wants to do the natural approach, which in some cases it works, and maybe that's what it is. But in some other cases they need treatment. And so I'm the one having to push patients. No, urologists are great. The right urologist will link you up, and so forth. So now the things have turned a little bit. Again, it's not a matter of one better than the other. It's a matter of, one discipline fulfills the deficiencies of the other very nicely, actually. And particularly in prostate cancer and urology. We were kind of joking before we started recording, prostatitis. None of you guys really want to see prostatitis. It's okay. But holistic, like mindfulness, meditation, powerful. Acupuncture, powerful for this group.
Hugely powerful.
They get benefits, and it's not the same, antibiotic and things like that. So we've come a long way, and I'm so happy I stuck with the work I do, and I get to see, urology and people in urology are just great people in general. I get to interact and see guys like you again, and really happy to see what you're doing, Phil, and we'll stay in touch. Thanks for your kind words. I really appreciate it.
Thank you, Gio. Always a pleasure seeing you.
All right. Be well, brother. Thanks for tuning in to this week's episode of the Dr. Geo podcast. You can watch all episodes of this podcast and much more by subscribing to my YouTube channel on youtube.com/Geo Espinoza ND. If you love what you heard today, you can help by leaving a 5-star review of the podcast on Apple and Spotify, as each review helps us reach more men who are serious about improving their urological health and how to function better with age. And for the latest research and actionable takeaways in the world of men's health and integrative urology, sign up for my newsletter at drgeo.com. I'll see you next time.